In this video, I want to share with you my wound healing story. In 2023, I had two orthopedic surgeries. The first was in February, and I had my right large toe fused. And then the second surgery was in May of that same year, and I had a total knee replacement also on the right side. The protocol was one in which I applied the F1 relief topically as soon as possible after surgery and in the vicinity of the incision, but not right on the incision, and then changed 48 hours after the stitches were removed. I applied the topical over the entire area. Now, I was also taking Relief F2 on a daily basis as an oral product, and that's part of my ongoing health regime. What really makes this a very good case history is that 4 years prior, I had my left knee replaced, and it was by the same surgeon, and so it makes for a very good comparison between what I did then and the use of the F1 relief in this surgery. Let's have a look at the results. Now, I must warn you that there are some very graphic images, and you may want to skip over those if you are very sensitive. Let's start with the toe surgery. It consisted of the removal of a significant amount of bone growth and the insertion of a metal plate to immobilize the joint. This first picture is 4 days after surgery. It is pretty gnarly looking at this point, but treatment has already begun. 2 weeks after the surgery, the staples were removed. Now, this video shows the staples being removed, and you can see that the incision is already well healed. Okay, enough of that. Now, after 4 weeks, the toe looks like this. And at 7 weeks, it looks like this. Now let's fast forward to 3 months. And this is what the foot looks like. And yes, there's a metal plate in there, permanently in the joint. As for the visible healing and reduced scarring, you be the judge. As for me, pretty impressed at that point. Now, there's one aspect to this picture that you may have noted, which is that my foot is red. Well, the knee attached to that foot was replaced the day before that picture was taken. So let's have a look at how that went. This is the right knee replacement, and here is the knee 1 day after surgery. While again it looks pretty gnarly, I have to give full marks to the surgeon for the work he did. At 2 weeks, the staples were removed, but I won't show a video of that this time. This is the knee after the staples have been removed, and as in the case for the toe, the extent of healing and reduced scarring is clearly evident. Here's the knee at 3 weeks, and the quality of healing has become really significant. And at 4 weeks, we compare this knee with the left knee that was replaced by the same surgeon 4 years prior. The left knee was also treated in a similar manner, but I used an earlier formulation based on CBD, cannabidiol. I was pleased with the way that knee healed at the time. However, a direct comparison between the two highlights that the right knee treated with the F1 relief salve was better healed at 6 months than the other knee was at 12. So what is the key to these results? Well, the results are actually consistent with the known chemistry of the various natural compounds present in RHS formula products. However, the key in this case is early application, getting the medicine into the vicinity of the wound as soon as possible, and then consistent use thereafter are crucial in terms of getting the best results possible. I hope you've enjoyed viewing this. Thank you.